I want you to take a second and think about your morning routine. Maybe you wake up, put the kettle on, and head to the bathroom cabinet. You reach for that handful of pills, the vitamins, the supplements, the little helpers you've been told for years will keep you strong, keep your bones sturdy, and your mind sharp. You swallow them all down with a glass of water, feeling like you've done something good for yourself. You've checked the box for your health today, but what if I told you that some of those innocent pills, when taken at the same time, or even taken at all after the age of 60, are actually fighting a war inside your body? What if the very things you're taking to protect your heart or your brain are actually the ones quietly causing the damage? I'm Dr. Matthew Destar, Senior Health. After 2 decades in medicine, I've realized that the most dangerous place in a senior's home isn't the stairs or a slippery bathtub. It's often the medicine cabinet. We've been taught that more is better and that prevention means more pills. But today, I'm going to share some hard truths that the pharmaceutical industry doesn't usually emphasize, and that many doctors, quite honestly, are too rushed to explain in a 15-minute appointment. By the end of this video, you'll understand exactly which vitamins and common medications you should never pair together after 60, why certain health rituals are actually playing Russian roulette with your cardiovascular system, and how to stop the cascade effect before it steals your independence. This isn't about fear, it's about empowerment. It's about making sure your heart, which has worked for you for 6 or 7 decades, finally gets the exquisite care it deserves. 1. The calcium and stomach protector trap. Let's start with a combination that millions of seniors are on right now. Think about a woman like Helen. She's 68, active, but she's been taking a stomach protector, a PPI like omeprazole or Nexium, for her reflux for years. At the same time, because she's worried about osteoporosis, she's taking a high-dose calcium supplement. On the surface, it sounds like she's doing everything right. She's managing her heartburn and protecting her bones. But here's the bitter irony. The stomach pill she takes to protect her from acid is actually creating a backdoor for a heart disaster. Your stomach needs acid to absorb nutrients. When you use a PPI to suppress that acid long-term, your body's ability to absorb magnesium, calcium, and vitamin B12 collapses. Now, look at what happens when Helen adds that high-dose calcium supplement on top of this. Because her stomach acid is suppressed, she isn't absorbing the calcium efficiently. But even worse, when you take a high-dose calcium pill, it creates an artificial spike of calcium in your blood. Your body can't use all that calcium for your bones at once. So where does that excess go? It doesn't go to your skeleton. It deposits in your artery walls. This is called arterial calcification. It makes your arteries rigid, like an old, sun-baked garden hose, and contributes to the very plaques that cause heart attacks. If you are over 60, you should never blindly pair long-term PPI use with high-dose calcium supplements without a specific medical plan. You might be starving your heart of magnesium, the conductor of your heart's rhythm, while simultaneously stoning your arteries with excess calcium. The simple fix: get your calcium from food, dairy, leafy greens, or vegetables. It's absorbed slowly and used efficiently. And if you're on a PPI, ask your doctor, do I really need this for life? Or can we try H2 blockers like Pepcid that are gentler on my nutrient absorption? 2. The aspirin and ibuprofen conflict. This next one is a silent neutralizer. Many of you take a low-dose baby aspirin every day to protect your heart. It's a common ritual, but then your knee starts acting up or your back feels stiff, so you reach for an NSAID, something like ibuprofen or Advil. You think, I'll take the aspirin for my heart and the ibuprofen for my pain. But here's the secret the labels don't always make clear. Ibuprofen can actually neutralize the protective effect of your aspirin entirely. It's like hiring a security guard for your heart and then giving someone else a key to lock him in the closet. You think you're protected against a stroke or heart attack, but the ibuprofen blocks the aspirin from doing its job. Beyond that, for those of us over 60, regular use of NSAIDs like ibuprofen or naproxen is like playing Russian roulette with our cardiovascular system. These pills force your body to retain salt and water. Imagine your heart as a pump. If there's suddenly way more fluid in the pipes, that pump has to work at maximum capacity just to keep up. A young heart might handle that stress, but an older heart one that might be fighting a little stiffness or high blood pressure, can simply fail. I remember a patient named Michael, 72. He loved his garden, but his knees hurt, so he popped anti-inflammatories daily like they were candy. He ended up in the ER with ankles swollen to twice their size and acute heart failure. It wasn't a new disease, it was the innocent little blue pill for his arthritis that pushed his heart over the edge. The simple fix: if you need pain relief, talk to your doctor about acetaminophen, Tylenol, or topical creams that work locally without entering your whole system. If an NSAID is a must, use the lowest dose for the shortest time possible, and never take it at the exact same time as your heart protective aspirin. 3. The brain fog. Duo, Benadryl, and bladder meds. We've all had those nights where sleep just won't come, or maybe the allergies are acting up, so you reach for a pink pill, Benadryl, or a PM medicine. At the same time, many seniors are taking a medication for bladder control, like oxybutynin. This combination is a direct attack on your brain's memory center, the hippocampus. Both of these drugs belong to a class called anticholinergics. They work by blocking a chemical called acetylcholine, the messenger your brain uses to create new memories and stay alert. As we age, our brains become desperate for every bit of acetylcholine they can get. When you stack these medications, taking one for sleep and another for your bladder, it creates what we call anticholinergic polypharmacy. The risk isn't just a little brain fog. Research has shown that seniors with a high cumulative burden of these drugs have a 120% increased risk of dementia. That's more than double the normal risk. Your neurons physically wither from underuse, and your brain enters a state that looks almost identical to Alzheimer's on a test. The simple fix: check your labels. Avoid anything that says PM or nighttime relief if it contains diphenhydramine. For allergies, use newer options, like Claritin that don't cross into the brain. And for your bladder, ask about newer medications like Myrbetriq that don't block that precious brain chemical. 4. Statins and the starved brain. Now, let's talk about statins, drugs like Lipitor or Zocor that millions over 60 take for cholesterol. While they are powerhouse drugs for heart health, there is a hidden side we need to be honest about. Your brain is composed of nearly 60% fat, and cholesterol is actually a necessity for your brain cells. It's part of the protective coating, the myelin sheath, that helps nerve signals travel. When we aggressively lower cholesterol with high-dose statins, we might be starving the brain of what it needs to function. The danger comes when you combine a high-dose statin with the normal forgetfulness of aging. I've seen families panic and push for a brain MRI because dad forgot a name. But an MRI in your 70s will always show something, what I call wrinkles on the inside. This starts the cascade effect. The MRI shows a spot, the doctor gets worried, they add more medications, and suddenly you're on 5 pills to treat the side effects of the first 2. The simple fix: if you're on a statin and feeling foggy or disconnected, don't just assume it's old age. Talk to your doctor about whether a lower dose is possible, or if a different type of statin, like pravastatin, which doesn't cross into the brain as easily, might be a safer choice for you. 5. The blood pressure, sweet spot, and vitamins. Finally, I want to talk about the vitamins you take while managing your blood pressure. Many seniors are told that 120/80 is the gold standard. But recent research suggests that for those of us over 75, pushing the pressure that low can be deadly. When your blood pressure is forced down to textbook perfect levels, and then you add a medication that might cause dizziness, like certain antidepressants or even some supplements, you are at a 28% higher risk of a serious fall. If you stand up at night to go to the bathroom and your brain doesn't get enough blood flow because your pressure is too perfect, the room spins. You reach for the wall, you miss, and suddenly we aren't talking about numbers anymore. We're talking about a fractured hip and a loss of independence. The simple fix: perform a simple test at home tonight. It's called the orthostatic test. Check your blood pressure while lying down, then stand up and check it immediately. If your top number, systolic, drops by more than 20 points, your medications or supplements are too strong for your aging pipes. For many over 75, a sweet spot of 130 to 145 is actually safer and leads to a longer, better life. A message from my heart to yours. I know this feels like a lot. You might be looking at your pill organizer right now and feeling a bit overwhelmed, but please hear me, it is not too late. The human body has a capacity for recovery that still humbles me after all these years. When the medication burden is lifted, when we stop pairing the wrong things together, I have seen seniors regain their mental clarity, their energy, and their joy in just a few weeks. Your heart has been beating for you for over 60 years. It has worked in silence, never asking for anything in return. It's time you gave it something back. It's time to be an active partner in your health, not just a passive recipient of a prescription. Next time you see your doctor, take a list of everything, every vitamin, every herbal tea, every innocent pill. Ask the hard questions. Is this target still right for my age? Are these two pills fighting each other? Is there a way to do this with food instead of a supplement? Because at the end of the day, health isn't about having a perfect chart. It's about being able to walk your dog, play with your grandkids, and live your life with dignity and independence. If this conversation gave you a bit of clarity today, do me a favor. Share it with one person you love. Maybe a friend who you know takes a handful of vitamins every morning. You might just be the one to stop their cascade before it starts. Take care of yourselves. And remember, sometimes the healthiest thing you can do is just a little bit less. I'm Dr. Matthew. I'll see you in the next one.